You've heard me say many times that what happens in rural Tennessee matters to every Tennessean. Together, we've acted on that belief. From my very first executive order for rural counties to investing hundreds of millions of TennCare shared savings dollars to strengthen rural health care. And we all know how hard this issue of rural health is. And while we've made some progress, we have much more work to do to deliver better care closer to home. We now have an opportunity like we haven't seen in decades. Thanks to the Trump administration, resources have become available through the Rural Health Transformation Fund, awarded just 1 month ago, that'll provide Tennessee with $1 billion over the next 5 years to transform healthcare in rural communities all across our state. That's $1 billion for our rural hospitals and our rural EMS and our rural primary care doctors. This Rural Health Transformation Fund has given us an opportunity that we have to make certain that we do not miss. In order to be eligible for these federal dollars, Tennessee must take legislative action to make it easier for medical professionals to practice and easier for rural healthcare facilities to operate. Right now, government overregulation stands in the way of that. If your child has strep, why should you have to drive an hour away to see the pediatrician when your neighborhood pharmacist could test and treat your family right then and there? And in a rural community with a shortage of doctors, why can't we both train more physicians and make it possible to see the fully trained physician's assistant down the road? And when a rural facility loses its supervising physician, should we really force the fully trained nurse practitioner to close her doors to the community as well? These are real scenarios in rural communities all across Tennessee. We have a solution that will mean more providers in rural counties, shorter wait times, care closer to home. And that solution is to get government out of the way and to let those providers practice to the full extent of their training, and we should do that this legislative session. But it's not just about letting providers practice. We also have to let them open their doors in the first place. Rural Tennessee's growing. Our communities need more options. But right now, if a doctor wants to open a new clinic in a rural county, or if your hospital wants to build an imaging center closer to the families that need it, existing certificate of need laws make that nearly impossible. These laws were created over 50 years ago to prevent hospital overbuilding, but today what they do is block investment. They limit competition. They leave rural communities with few or even zero choices. Since the year 2000, certificate of need laws have turned away nearly $1.5 billion in healthcare investment in our state. Those are clinics that were never built, beds that were never added, care that never came. States like Texas and Florida, they got government out of the way. And as a result, their rural communities have more hospitals and more surgery centers and more options to care for their people. This General Assembly began reforming these laws years ago. We should finish the job for rural Tennessee, and we should finish it now.